welcome to the Seven Investing Podcast. I am Dan Klein. I think this might be my first time actually hosting the Seven Investing Podcast. I am joined today by Max Chasko. We just taped Seven Investing now, and now we are jumping back on. We're going to talk about the American Association for Cancer Research, an organization I have known existed for a couple of hours maybe. That is the AACR. They're having their annual meeting. Max, I'm going to assume this is a group that's against cancer. They're trying to end cancer. They're not trying to advance it, but that is how little I know. You are the subject matter on this one.
Yeah, so the AACR is an annual meeting. It's a scientific meeting, and this year it's being held virtually, of course, but it starts this Saturday, April 10th, and it runs through next Thursday, which is April 15th.
So in a normal year, what does this meeting look like? These virtual conferences, we'll get to that in a second, are a little bit weird, but what does it look like in a normal year?
Yeah, so normally, this is a great place for cross-pollination of ideas. And for this specifically, it's very heavy into the science. So it's where, academic researchers, maybe there's some major medical research centers, definitely companies and industry are there. They're presenting their data on kind of the frontiers of science, right? So we face these challenges when we're trying to develop new cancer treatments. Everybody gets together in a room and discusses what they've learned, their ideas for engineering ways around those obstacles, and what looks the most promising. What do we think was promising a few years ago that maybe we're abandoning or moving in some new direction? So it's really important for looking at the frontier of what's going on in research.
So what's the goal of presenting it? Because I know if I'm a company and I'm working on, a cancer cure, I'm not entirely sure I want to tell another company exactly what I'm doing. So how do they balance sort of the science, and obviously collaboration can help, but there's an underlying business here as well. So how does that play out in this type of setting?
Yeah, so that's a good question. A lot of this, though, is once you're presenting at these conferences, you already have the asset and the intellectual property around it pretty well protected. So if you're presenting research, that's your asset, that's your chemical compound or your cell therapy now, and you're advancing that into preclinical studies and clinical trials. So at that point, there's certain things you can do to design trials that get you better data or data more quickly. Whether that's enrolling the right patient populations, right? But once you're here, it's kind of the science takes over. So did you do your drug design and discovery correctly? And then it's just kind of how does it compare to your peers and your competitors and what's going on?
Is this a conference you've physically attended, or have you only covered it remotely?
Yeah, I've never been to this scientific meeting, so I've only ever covered this remotely.
Do you expect big announcements to come out of it? It seems like every time there's one of these giant medical conventions that we do seem to see like major advances in sometimes theoretical work. Like I don't expect like the cure for cancer on day 2 of this, but you might see somebody come out and say, we have something that can make this 8% more effective, or a new delivery method, or what it is. Do you expect there to be big news in this weird virtual version of a conference?
Yeah, so that's true too. Like the virtual conference thing, it is a lot different than being in the same room as scientists together. There's a lot more collaboration that goes on, maybe even more partnerships if you're a company or even working with a research institution. So the virtual aspect does take a big bite out of it. In terms of what announcements could be made, this isn't the J.P. Morgan Healthcare Conference. This isn't ASH. Those are two of the bigger conferences in healthcare technologies. This is more focused on earlier stage research, but it's also, again, the first look at some of these new technology platforms or new pipelines or new companies. So depending on what they present, and if the market likes that, and especially it's all relative. So how does it compare to what other peers are doing? We could see some pretty big movements next week in the stock market, at least in terms of, okay, maybe this is a little less risky than we thought it was before. But mostly this is about earlier stage research and asking more questions than presenting data.
We're going to talk the investing angle in a little bit, but I want to set the table a little bit here, because obviously cancer has touched probably everybody you know. I have a cousin who recovered from breast cancer. I have a cousin actively battling leukemia right now. He's well maintained, but it's something he'll deal with his whole life unless science advances to the point where he doesn't have to. How big is this market? Because it does seem like there's an awful lot of money being thrown at the problem, which is a great thing. None of us want to get cancer. None of us want to go through a relative with cancer, or friend even.
Yeah, so every year there's 9.5 million deaths globally from cancer. I actually saw a stat. It was maybe 3% of individuals age 50 and older have any type of cancer. So obviously it's very prevalent. And that fatality statistic includes 600,000 deaths just in the United States. So, but we've seen a lot of promise and a lot of advances here in recent years. We have a deeper understanding of biology. We have better tools now for looking at the genetics of it, genomics, different other omics. So we are designing and developing better tools, more selective tools. So we are gradually seeing, improvements in survival rates and treatment rates. And sometimes, in very specific instances, we are seeing, complete responses. So that's kind of what we call cures, but scientists don't like to call it that. So the future is always promising, Dan.
I have an uncle that I won't go into a specific cancer, but he was basically given a get your affairs in order and ended up in a drug trial and has been not cured because it's still there, but has the prospect of a significantly longer life, if not the prospect of that not being what kills him. So that is very encouraging. Let's talk a little bit about this for investors, because so theoretically on Monday, company X could come out and say, here's our developmental pipeline, here's what we've tested, it works this well, and everyone's really excited and the stock goes up. But then on Wednesday, somebody else could present better data, right? So as investors, we have to be a little bit cautious on making moves during the convention. Is that fair to say?
Yeah, exactly. And data will be relative compared to peers and what else is out there, maybe even academic research, right? Could pull everybody in a different direction. And also because of the early stage nature of the data that are going to be presented, if this does have a large move or a large, factor impact on stocks, maybe that's a bit of an overreaction, right? Because a lot of this is going to be preclinical research or very early clinical stage research. So there's still years of development ahead. Still things can go wrong, but I would encourage investors to use this as a way to maybe, test your hypotheses. Is this technology platform, is it delivering at least at this stage of its development? Does it look promising? It doesn't mean game over, you made it, winner, chicken dinner, but it can be a good indication that maybe, yes, this company's on the right track and it's worth a closer look.
I've never understood that phrase. If I win something, I want steak or lobster. I don't want chicken. Like I know it rhymes, but that one has never, that has never worked for me. So as an investor, this is more of like a touch point where you get sort of an update on where your investments are. It's not an endpoint. Is that sort of a reasonable way to look at it? And really, this might be an entry point. It might be a sign that something you invested in may play out. But we're still talking years for most of these companies.
Yeah, exactly. That's exactly right.
Hey, so I own a lot of these companies because I buy your picks every month. What should I be watching as an investor? Are there parts of this? The cool thing about virtual conferences is, while plenty of it happens behind a paywall, there also tends to be more public stuff than there is at a physical conference. So what should I be watching as an investor in some of these companies?
Yeah, so I'll put in the show notes or in the article at 7investing.com, I'll put a link to the this meeting's webpage, and you can check out all the programs there. There's a lot of different themes. Again, some of it's just scientific research, but there's a handful of major themes that I would encourage investors to look at. So 3 of them that we're going to talk about here would be genetic diagnostics. It seems to be a pretty big theme of this conference, and also, of course, in cancer. Next generation antibody drugs. There's a lot of excitement around cell therapies, and that's also a major theme at this conference. But there's some really promising next generation antibodies that are in development, and they're easier to manufacture, they're easier to administer. So I wouldn't necessarily write off antibody drugs. They're not antiquated technology by any means. Still a lot of innovation happening there. And the third category would be precision oncology, which is one of those terms, Dan, that gets kind of used by everyone. It means nothing, but if you know where to look at the right companies, a lot of really good and innovative research going on there as well.
So I want to go a little deeper into these three things and where possible, give an example of a company in that space. That isn't investing advice. This could be a company that's not doing well or not going to make it, but I just sort of want to set the table for where you start looking or where there might be investment opportunities. So genetic diagnostics, that essentially means the ability to look at my genes and see what my predilections are, what I might get, in some cases, what I definitely will get. Where does this stand now? How is it advancing? And what are the big players, or who are the big players in this space?
Yeah, so specifically in genetic diagnostics, I think the nearest term opportunity for investors is something called minimal residual disease, MRD. So this is for detecting, we can take a blood draw at your doctor's office, and we can look at the blood and see, do you have different biomarkers showing that you have a tumor present in your body? And we can give you this multiple times to see, is a treatment working? Is your tumor shrinking? Or maybe if we can see no evidence of disease, this is what you get every 6 months to see, has your cancer recurred? Is it coming back? Or has the treatment been effective and you still have no evidence of disease? So again, with better tools and better detection diagnostics, we are getting, better at using this. And this is way simpler than imaging or obviously a biopsy or something, right? So it can give us a really good indication to guide treatment for individuals. So in this case, because this is more, early stage research, we hear a lot about like genomics, right? It's the genomics revolution, this, that, and the other thing. But the reality is, it's probably more accurate to say that the future is multi-omics. So genomics is the study of genes, but then there's transcriptomics, which is the study of RNA. There's proteomics, the study of proteins. Metabolomics, the study of metabolites. Dan, that's probably something for your wearables idea for how that's going to change. If we can, pick up metabolites with an Apple Watch or something, right? That would probably be a metabolomics application. So maybe we can have that coming to a wrist near you very soon.
So let me jump in, Max. It's all of this together, all of these omics, theoretically, with just a simple blood draw, going to give us a better picture of our health, meaning that you might catch things much earlier due to biomarkers, and that generally increases survivability, right? Like if you figure out you have a cancer on day one instead of 6 months in, that's really good, right?
Yeah, absolutely. I mean, there's if the earlier you detect a cancer, it's way easier to treat because the tumor might be more localized or different treatments are more effective. Once that's into a later stage, more advanced cancer, maybe it's spread to the lymph nodes or other parts of your body, way more difficult to treat. So we're not quite there yet, but it does look promising. It does look like we will get there eventually, where maybe at your annual physical checkup with your doctor, if people do that still, I don't know. But you might get a blood draw every year, and we just do this pan cancer profiling, it's called. So that means we just look at different genes that we know, are indicative of cancer. You might be fine and healthy, have no symptoms, but maybe one year you go in, you get the blood draw, and bam, hey, look, you actually have some early stage cancer. Let's go check this out. Your survival rate is going to be close to 100%, and definitely, in the 80%, 90% range. That's way better for a lot of these cancers. Look, melanoma is a good example. I've actually had something on my back removed that wasn't very good. But if you detect, melanoma very early, your survival rate's almost 100%. But as soon as it spreads to other parts of your body, that drops down to, as low as like 15 or 20%. So it's one of the deadliest forms of cancer once it moves to other parts of your body. That's kind of ironic because your skin's the only organ we can actually see and observe. So for people to not catch this early is kind of, ironic. But again, this is a good example of, some next generation diagnostics using genomics or these other omics that can really help improve prognosis.
And this is a major reason why Max never wears a shirt anywhere in public. He wants everybody to know it is a real call that if you're not going to the doctor, you should be having someone check you out, because a lot of people, their annual physical this year was over telemedicine, meaning you're going and doing your blood work at the lab, but you're not getting the doctor giving you the visual once over, which is something they normally do. So you can't look at your own back. That is really tricky to do. So you do want a partner or a good friend or, not a stranger to generally, check you for these things. But so are we getting to the world where, Max, do you believe we're going to make big advances? And obviously this isn't the conference where you'll see the big advances, but are you starting to see the foundation being laid for earlier detection and better treatment across all sorts of types of cancers? I know I'm digressing here, so don't take too long on this one.
No, yeah, absolutely. You're right. So there's a couple companies that are working on, next generation liquid biopsy platforms. So liquid biopsy started with an easier, quote, easier problem. It's all relative, of course. So can they detect biomarkers in your blood as well as a tissue biopsy? So they got to that point. We have those diagnostics. Some of those are actually approved on the market right now. And now they're working on the more difficult problems. So how early can we actually detect these cancers? So those earlier detection diagnostics might not be here until the end of this decade. And that's because the signal in your blood is very, very low. If you have an earlier stage cancer, there's not a lot of biomarkers that we can detect necessarily, or we will have to use probably multiple types of biomarkers in order to get an accurate assessment. But yeah, different companies, and I don't think, as far as I've seen, these aren't presenting at this conference, but I think some of the discussions and some of the research and some of the discussions that are happening here will influence these companies, and again, give you an indication of who's making the right investments, whether that's in-house or acquisitions, or where might they need to go and acquire, build out infrastructure, to kind of position themselves for the future. So these companies are, Exact Sciences, Guardant Health, Grail. So those are the major liquid biopsy companies. But there's also other companies like Adaptive Biotechnologies. It's working on a slightly different technology platform. Uses T cells, but it's basically on the same idea and maybe even broader than what those other companies are. Neogenomics, Invitae, a lot of different companies here trying to look at detecting cancers from the blood, whether that's minimal residual disease or early stage liquid biopsies or other tools. So definitely promising, definitely a space with heavy investment, Dan. So this is something that the conference is like key themes, I think, for investors here to look at.
I pity the fool who researches T cells, of course, which I assume are cells taken from Mr. T. But yeah, he could clearly kick cancer's ass. I think he did. I actually think Mr. T had cancer and has since recovered. I'm being a little silly here, but I am so encouraged by all of this. As talked about this, I'm 47. I'm at the age where things start to fall apart. So I love the idea that there's going to be easier detection. There's going to be all sorts of medical help, and it's he helps those who help themselves. So you want to take yourself, you want to stay in shape. You want to do the right thing. You want to do as much as you can. You don't want to go like lay out in the sun. I've been pretty diligent with sunblock and things like that because I live in the center of the sun land. But that said, Max, you have here the second topic one here is that next generation antibodies, biospecifics. Other than that, sounds like a Marvel team up. I don't know what that is. What are next generation antibody biospecifics?
Yeah, so it's bispecifics. There's no O.
Oh, no
That's
O.
all right. That's all right. That's all right. So yeah, next generation antibodies. Again, so like genetic tests can tell us, hey, maybe you have cancer, or guide treatment options. But we have to guide those treatment options. We have to guide people to the treatment, right? So a lot of drugs in development are targeting a very specific aspect of a cancer. So most drugs in development are targeting a specific mutation, and there's a lot to choose from, lots of funny names. Usually they have 3 or 4 capital letters, which is the name of the gene, and that's what they're trying to inhibit or target, right? So if investors are looking at pipelines or press releases or presentations, they're probably familiar with some of this terminology. Next generation antibodies are very interesting to me. I think this space is also heating up. So an antibody, Dan, is shaped kind of like the letter Y, like a uppercase Y. So it has these 3 arms on it, right? And traditional antibody drugs are some of the most successful drugs in the world. I think like 5 of the top 10 best drug sellers globally by revenue are antibodies. I think it might even be more than 5. So tens of billions of dollars in annual revenue. But there's this next generation, technology which is called bispecific. So in a traditional antibody drug, the ones that are on the market now, they link up to one receptor, whether that's on an immune cell or on, somewhere in an inflammation pathway or on a cancerous tumor, right? So they link up to one of those targets. A bispecific, as its name implies, is engineered to actually target 2 different things at the same time. So maybe it can link up to an immune cell and, some part of a cancerous cell. And maybe even, so it affects more of the underlying biology. It can affect, how your immune system responds or rallies to that specific mutation. So these are kind of like the next evolution of our understanding of antibodies. So they can allow for, more potent drugs. Maybe we need a lower dose to get the same response. Much safer drugs because they tend to be more targeted, and much better, long-term prognoses in terms of mutations. Cancer can't mutate off the pathway as easily when we're targeting multiple aspects of it.
And Max, there's a number of companies presenting on this. What are some of the highlights you're going to be watching for?
Yeah, so there's not too many different companies in biospecifics right now. Most of the technology in terms of intellectual property is wrapped up by two companies in particular. So Xencor is kind of the leader. And then there's this European company called Maris, which owns most of the other IP related to this. It might even have better technology if you, depending on how you read it. They actually have something called tri-specific antibodies, Dan. So that's targeting 3 different receptors.
Oh, I'm working on quad specifics. We're steps ahead at the time. I'm going to be the secret guest present. No, I'm not. But I was going to ask you that jokingly if tri-specifics was
coming
yeah.
Next. Yeah, scientists aren't terribly imaginative when they're naming things, but bispecific, tri-specific, yeah, same thing. So Xencor is presenting data for 4 preclinical assets, and it actually has a couple different drugs on the market through partners right now. So it has an interesting business model. So far, it's focused mostly on licensing. So that can be a little difficult to navigate as a shareholder. Companies can often out-license too much of their future economic potential. That does de-risk development, but they also had some interesting problems and setbacks within recent years of some of their first generation tech didn't work out so well. It was abandoned by partners, so they got let go. But so looking at some of these early preclinical assets, some of the next generation tech they're working on will be interesting for investors. And then for Maris, that's, again, one of the companies kind of under the radar. It's still pretty small. But very recently, they just signed this big partnership with Eli Lilly, up to $1.6 billion, depending on how it progresses, for up to 3 different bispecific drug candidates. And that company's presenting data for 2 different assets. Its lead drug candidate's called Xeno. That stands for some other longer name of an antibody drug, but I can't pronounce it. Neither can you. So we'll just call it Xeno for now. That's what the company calls it. I like it. It's targeting something called NRG1 fusion. So that's a relatively small mutation. It's not very prevalent, that means, in a lot of different cancerous tumors. But we do know that targeting fusions can be highly effective. And this is exactly the application that bispecifics were made for. So if that presents, if they present more data that are promising and live up to some of the earlier data we've seen, that could really put Maris on the map, or maybe even, give more credence to why Eli Lilly sought it out in the first place.
And then lastly, Max, you've got Agenus. Am I saying that correctly?
I think it's Agenus, but I don't know. I never know how to pronounce some of these companies. We've had members correct me on pronouncing things too.
Agenus sounds a lot more likely than Agenus. I think that is probably the case.
I covered most of these for a long time, so I know how to say most of them, but I still do look at YouTube every once in a while, like, am I saying this correctly? Yeah. So, Agenus is also presenting data. It's the data it's presenting is for something called an FC engineered antibody. So it's not quite a bispecific, but actually, so the FC stands for crystallizable fragment. I don't know why they switched the letters there. That's just how biologists are. So this is actually part of bispecifics as well. So we can engineer parts of that Y, if we go back to the shape of an antibody, to make it, more potent, have a higher circulating time within the body, or be more targeted and safer. So this data that the company is presenting for its FC engineered antibody is going to be important for indicating, what direction it's going with, because it does have a bispecific pipeline that's earlier in development. So if those data are encouraging for this asset presented at AACR, then that might be good news for, the earlier bispecific platform in development at Agenus.
You are listening to the 7 Investing Podcast. I am Dan Klein. He is Max Chatsko. We are talking about the American Association for Cancer Research, which is having its annual meeting virtually next week. Max, we're going to tie this all up for investors at the end. But before we do that, precision oncology. Now, those words both mean something to me, but where are we in that, and what do we expect to see at AACR?
Yeah, so as I teased at the top, this is one of those terms that I hate. Like everybody uses precision medicine, precision oncology, genomics, synthetic biology. Like everybody uses it, and then it just means nothing what it was, intended to mean. Like everybody has their own definition. So precision oncology, though, is about, or precision medicine in general, it's about designing more selective drugs. So this is very heavy into technology platforms. So really, these companies in this space are developing tech platforms that really try to understand the genetics of a cancer. So they're trying to find specific mutations within a tumor that they can target. But then in order to target it, they have to screen thousands and thousands of different molecules to find something that's very selective. It's not going to go and accidentally, target similar looking proteins or mutations. So that's where the precision part comes in. And companies have various ways of doing this, and several of the leaders are actually presenting at this conference here. So Loxo Oncology, you have to start there. This is actually an Eli Lilly company, and it was the subsidiary that partnered with Maris that we just talked about in the last section. So anytime Loxo Oncology comes knocking on your door for a partnership, that's probably a pretty good sign for investors in terms of what that company might be capable of. So Loxo Oncology was a standalone company a few years ago. It was acquired by Eli Lilly for about $8 billion. And this is a leader in precision oncology, just has a really good technology platform for screening out drug compounds and selecting really good genetic targets. So the company's presenting data on now it's Eli Lilly, presenting for multiple different assets, but it has something called its RET, its RET inhibitor. That's really what put it on the map and had it get acquired in the first place. But it has a couple of next generation RET inhibitors as well. Again, targeting like more specific mutations. So maybe patients who've been treated with their first drug develop resistance. Well, then they can come back and hit it with a second generation drug and a third generation drug to really extend, response times or durations and help more patients really put their cancers into remission. So a very rational way of going about it. This company is also targeting something called a KRAS inhibitor. A KRAS mutation. And that's something this is the most prevalent mutation in cancer tumors, Dan. So about 22% of solid tumor cancers have a KRAS mutation. And currently there are no approved drugs on the market for it. It's been a very difficult mutation to target. There's a lot of activity and investment going on, trying to develop drugs for this. So people will see this term time and time again. If you're an investor, definitely one to keep an eye on in terms of, how does the competitive landscape look and who's kind of well positioned to treat this mutation.
So Max, let's bring this home a little bit for investors. If you hold shares of these companies, are you expecting, these aren't buy and sell events, right? Like if there was terrible news, that would have come out beforehand. You're generally presenting things that worked, would be my assumption, probably not your failures.
Yeah, exactly. So that's important to say at the top, right? If I mention these companies, it's not because I think, buy. These are just ways to keep track of trends and to look at the competitive landscapes within these themes. It doesn't necessarily mean you buy any of them. But yeah, and this isn't really a big event for like, we're not going to see any companies say, yeah, we've cured that cancer with that one mutation. We might get some really good data and we might get some mixed data. And that's going to influence decisions that these companies make, developing their pipeline down the road. But yeah, this is more of a way to, again, check your thesis, make sure you're on the right track in terms of if you're interested in these companies. Maybe they're more de-risked than the market is pricing them at, or maybe they're overvalued based on what the data say. So there's lots of different ways to go, but this is really to check, kind of like take the temperature of the room, right? What are the challenges and opportunities, and what do these data mean when these companies present? Where does it fit in?
And Max, are the bigger players in this space or in healthcare in general watching this, and is it like a Sundance Film Festival where acquisitions may come out of this or partnerships?
Yeah, so that's the thing. Like usually when these are in person, lots of collaborations, licensing deals come out of these conferences and these meetings. Because just face to face, you can't beat that. So we could still see that with the virtual conferences. We have seen that, with like JPM or ASH earlier this year, or during the pandemic anyway. Um, so that's something that you can't write off, but it's so much harder to do when you're virtual.
It is the challenge. And I go to a lot of trade shows. I probably go to somewhere between 6 and 10 a year. And the keynotes are nice. The presentations are nice. The show floor is great. You might get an announcement that's newsworthy and good to write about. But the reality is, most of the business takes place over drinks or coffee or a meal or at a company event. It's the two people getting together and talking that leads to people jumping companies, that leads to deals being made. That's not happening. So I give all of these conferences credit for having these virtual things, but I would say for the most part, other than Consumer Electronics Show, which I paid attention to sort of the news summaries, most of the conferences that I go to, I actually haven't paid that much attention other than scanning for news, because most of what I do at a convention, I think this is true in most industries, it's not what the official programming is. It really is you're loose, you're relaxed. In my case, they're almost always in Vegas. Everyone is having together, and that's where collaboration, that's where ideas come from. Little bit harder to do that. I mean, we've had our Zoom happy hours as a company, and they're fun, but they're not the same as all sitting around a table. There's all sorts of technology issues. So this might be a quieter year, but after this convention, we promise we will either do another podcast or we will do a 7 Investing Now segment to sort of wrap up the news here. Hopefully there's some really good news, because a lot of us are going to get cancer, or someone in our family or our circle of friends is going to get cancer. So these can be wins for all of us. Max, I'll give you the last word. Anything else we want to say about the AACR or what investors should be looking at here?
No, again, just to wrap it up, I mean, there's a lot of, this is going to be early stage conference, and it's a scientific meeting. It's not an industry meeting, so that does color it a little bit differently. Like you said, I mean, I go to a lot of industry conferences as well, and those actually have like specific partnering, time slots and things baked into those schedules. Not so much here, but there is a lot of that, cross-pollination of ideas. There's already some tabs and collaborations behind the scenes with, researchers at different companies, and everyone's kind of aware of what's going on. But yeah, so it might be a quieter year in terms of acquisitions or partnerships. But for investors, at least, again, good way to double check your thesis, make sure companies that you're interested in are moving on the right path. Or maybe there's something else that gets discussed at this meeting that, kind of shows that another way that a lot of people are trying to, target cancer or cell therapy might not really be positioned for the future. So lots of different insights that can come out of this conference, Dan.
So in biotech in general, don't make investing decisions based on a news story. Really look to someone like Max. His 7 investing picks are often in this space. Look at the underlying story. And again, this might be companies that are in very, very early stages, and they might get acquired, and that tends to be good for investors, but it also sort of ends the story. They might get big, but don't see something on CNBC 3 days into this conference, and not to pick on them, or really any CNN, any news site out there, and go, oh my God, this company has it. Because one, the vast majority of people reporting on this are not scientists. So they are not really fit to filter this. That's why we promise we will come back again and talk about this, and any real news that comes out of this, we will make sure the 7 Investing audience has it. With that, we've reached the end of the 7 Investing podcast. We are 7 Investing. We are empowering you to invest in your future. I am Dan Klein. He is Max Chasko. I almost thanked Sam Bailey, but she's not actually producing behind the glass here. But hey, thanks, Sam, anyway. Some of the people watching are brought in by our marketing department, which she leaves. We'll see you soon.